Welcome to the program. I'm Jeremy Fernandez. 12 to 15-year-olds are being added to the national vaccination rollout. But will there be enough vaccine doses to go around? Also coming up, is it time to start planning booster shots? Some don't think so. Not yet. We'll tell you why. But first, the nation's vaccination program just got a little bit bigger. Children aged 12 to 15 are being added to the program. That's an extra 1.2 million school-aged kids who'll be soon rolling up their sleeves. ATAGI, the group advising the government on immunisation, has found that the Pfizer vaccine is safe for those in that age group. But Pfizer supplies are still limited.
We have some promising leads in terms of doses. I can't confirm those at this point, but we've been working on them now for some time.
School staff in New South Wales will be given priority for vaccinations. The government there has revealed its long-awaited roadmap for students to return to face-to-face learning. It'll be a staggered return to school. Kindergarten and Year 1 students will be the first to go back at the end of October. Let's go to Casey Briggs now for the latest on the COVID case numbers.
Well, Jeremy, aside from the fact that dancing's now legal again in southeast Queensland, there's not a whole lot of great news that we can share about the outbreaks ongoing across the country. We can only expect, we have to assume that cases will continue to rise each day in New South Wales on average, as will the number of people in hospital, which grew by about 10% just on Friday. In Victoria, we've got now, well, these case numbers are still low enough that this thing could be extinguished, but things are trending in the wrong direction. We're seeing the number of people exposed to the community while infectious climbing, and we're maybe now starting to see some early signs that contact tracers are falling a little bit behind in their work. A short, sharp lockdown, this is not. And the ACT, well, cases are still rumbling along there, and a smattering of them remaining infectious in the community with exposure sites. So more work needed there before that one can come down to zero, if it comes down to zero. At least the number of doses of vaccines going into people's arms, that is continuing to climb. And soon we'll start to see from next month 12 to 15-year-olds booking in en masse to get their jab as well. The ACT has actually decided to start including 12 to 15-year-olds, adolescents, in the denominator for its 70% and 80% targets, which won't really make a huge difference to how quickly they get there. It might add maybe a week or even less to the timeframes because it really just pushes the targets up by a few percentage points. But it will offer those adolescents extra protection, of course. But there is every chance that the ACT gets to 70% vaccinated of the 12-plus population, while only a very small sliver of 12 to 15-year-olds are actually vaccinated. Let's look overseas to Israel, where, by the by, about 45% of 12 to 15-year-olds have had at least their first dose. We're seeing a surge in the number of vaccine doses administered each day at the moment, but these are not children and more adults coming forward for their first or second doses. These are, in fact, booster doses, largely an attempt at boosting waning immunity with a third dose to try and combat a serious Delta outbreak. And another place with a serious Delta outbreak is the United States, where we're seeing, sadly, deaths from COVID-19 continuing to climb once again amid those serious outbreaks, mostly in the south of the country. And of course, Jeremy, these outbreaks, these deaths are concentrated among the unvaccinated, who still make up quite a large portion of Americans.
Casey, thank you. So as Casey mentioned, some countries are already giving boosters to their populations. Professor Kanta Subbarao is the director of the WHO Collaborating Centre for Reference and Research on Influenza. She's also a virologist at the Doherty Institute. She joins us now. Professor, should Australia also be taking concrete steps to give people boosters?
There are two aspects to it. One is the scientific rationale for doing it, and then whether it's actually the right thing to do in terms of vaccine equity. So scientifically, there is evidence that antibody titers decline over time. We know this in people that have recovered from COVID-19, and the same is, turning out to be true for people that got vaccinated. So does that mean that as the antibody titers decline, does that automatically mean that vaccines are less effective over time? There's some evidence that people that were vaccinated more than 6 months ago, with the declining antibody titers and the emergence of the Delta variant, have somewhat less protection from becoming infected. But the good news is that they're very well protected from severe illness and death, hospitalization. So the vaccines are still very effective at doing what they were intended to do, which is protect our healthcare system.
So will eligibility for a booster depend on which vaccine type you had the first time around?
No, that's not very likely, at least in Australia, because both the vaccines that are available, both types of vaccines that are available in Australia seem to have quite, good immune responses, and the longevity of that response seems to be quite similar. So I think there's scientific evidence, it's most striking in people that have underlying immune compromise, because the data in people that are immunocompromised is that maybe they do need 3 doses. For everybody else that they're talking about a booster dose, we're really talking about shoring up the response to the original primary vaccination, because the antibody titers are dropping and because there's a variant that's emerged. And I would argue that the fact that a variant has emerged does not necessarily mean that we should be offering boosters to the entire population, because the vaccine is still very effective in preventing severe illness and death. And that brings us to the equity question, which is that globally, according to the WHO Director General, only about less than 2% of the world's population has been vaccinated. So if high-income countries that have used already the bulk of the available vaccine to vaccinate their populations start now offering a 3rd dose of vaccine to their populations when 98% of the world is not vaccinated, this doesn't seem to be a way out of the pandemic. As long as we have unvaccinated people, large populations of unvaccinated people that get COVID-19, we're going to run the risk of having variants emerge. So what is the game plan? Are we going to just keep vaccinating people in high-income countries over and over and over again over time, while the pandemic continues because there are large populations that are unvaccinated?
Well, on that, where does that leave the urgency of Australia's booster program?
When you look at it from the larger view of the world, I would say at this point there's scientific evidence to support vaccinating people that are immunocompromised with a 3rd dose, but that there isn't a strong evidence yet that people should be revaccinated or given a 3rd dose or a booster dose of vaccine at this point, because the vaccines are actually still very effective in preventing severe illness and death. And that what you would use as a booster dose should in fact be shared with our neighbours.
Is there a benefit for Australia in holding back and seeing the evidence on boosters from other countries?
Well, so that's a double-edged sword, because of course, we were slow in vaccinating in our first round. So I'm sure that the Australian government doesn't want to be slow in embracing the next step, if that is what the next step has to be. So I think that's a tricky one, because it's hard to say hang back when they are already sort of behind on the first round of vaccination. But I think that we still don't know what the ideal time is to give that booster dose. And so it's certainly not going to be tomorrow. It's going to be a few months after we finish the first round. And so I think there will be some opportunity. We'll get some data from their studies that are going on in the UK and elsewhere, where they're looking at boosters. And I think we will learn more from countries that have already implemented boosters to see how much of a difference it made there.
Professor Kanta Subbarao, thanks for joining us.
Thanks very much.
Well, New Zealand has extended its nationwide lockdown until next week, and it could run into extra time for residents in Auckland. Despite the Delta variant continuing to spread in the community, Jacinda Ardern is sticking by the government's elimination strategy. Jessica Much-Mackay is the political editor at TVNZ. She joins us now. Jessica, how committed is the government to the policy of eliminating COVID in the community, even as the case numbers go up and up?
Yeah, I think we've been living with this plan for an elimination strategy for a while, and I think a lot of New Zealanders have brought into this. We've gone through those tough lockdowns like you have in Australia, and I think we're committed to doing that. The trouble is that we're just having to get our vaccination rates up at the moment. At the moment, for us, the plan is to do that before the end of the year to get most of our population offered a vaccine at least. But I think in terms of the elimination strategy, we're going to have to wait and see where we're at the end of the year, because if there are some parts of the population, young children, for example, who aren't vaccinated, what that will mean, and the science is still developing on that. And also we need to know more about how we're transferring it to other people as well. So at the moment, we are very much Fortress New Zealand, and we're still on that path, but the government has realise that we are going to have to address it and come up with a plan for how we can still have people coming into New Zealand and we can still interact with the rest of the world from our small country at the bottom of the world.
And there's this real-time example of what Sydney is dealing with right now. Does the lockdown in New Zealand have broadly good public support?
It does at the moment. Just a short time ago, we learnt that probably Auckland, our biggest city, will have another 2 weeks at what we're calling level 4 lockdown. So very strict restrictions, no schools open, no daycares open, you're allowed to go to the supermarket, that's about it. So they will do another 2 weeks. Now, that includes Northland, so everywhere south of Auckland will do another 4 days at level 4, and then we will go down to level 3. I'm in Wellington, so we'll be going down to level 3 at midnight on Tuesday. And that basically means you get a few more allowances, takeaways, for example, and childcare open for essential workers. So a few bits and pieces like that, but still pretty tough. I mean, as you know, we haven't really been through this as much as you guys have. It's been a year since we were in the level 4 level restrictions. And so it has been a while. I think we are still buying into it because we still get it, but that won't last forever, that feeling of goodwill. But at the moment, I get the sense that the public are buying into it.
The outbreak in Auckland is now primarily in the Pacifica community. Talk us through how that came about, because there have been quite serious allegations about racism directed at that community because of the size of the outbreak.
And that's just a lack of understanding for people about how this works, because this church was just caught up in this. The person, one of the people went along and then it spread. It was a lot of congregations coming together and all celebrating. It was before anyone knew about the outbreak. And this church just happened to be the group that was caught up in it. So the church hasn't done anything wrong. And that's a really difficult part of this. So there's a few elements at play here. I think we've always been warned that churches are dangerous places to be. You're standing next to a lot of people, you're singing often, that spreads things around as well. So that's a real problem. And then these people went back to their places in Auckland as well. So I think that's one of the problems there. What they are doing now is they're setting up a specific testing centre for the church and for the parishioners and their families so that they can go there. But I think it's really important to realise they've just been caught up in this, and it's important that they come forward and be tested so that we can deal with this. I think we've tried quite hard in New Zealand to have if you get tested and are found that you're positive, congratulations for coming forward and being tested. And particularly Dr. Ashley Bloomfield, our Director General of Health, and our Prime Minister Jacinda Ardern have tried really hard to send that message. So the first case that tested positive in Auckland, both of them really tried to drill down to the public that congratulations for this person going and getting tested and alerting us all. Because of Delta, obviously it spreads so much quicker, and that's why we've had to go into this lockdown instantly as soon as we found out that it was the Delta variant.
Jessica Mackay, thanks so much for joining us.
Thank you very much.
And that is the vaccine for this week. Thanks for your company. Bye for now.